So I want to talk to you about supranuclear horizontal gaze deviations. And the reason it's important is you have to first differentiate whether or not it is too much or too little. And so that's the difference between a stimulating irritative lesion and a destructive lesion. So it's got to be supranuclear because that's the cortical control of the eye movement. As you know, the horizontal gaze pathway, the final common pathway, is in the pons. That's the parapontine reticular formation and the sixth nerve nucleus, and its connections to the third nerve via the medial longitudinal fasciculus. So when you have supranuclear control of your horizontal gaze, that is directed from the cortex, and that's from the frontal eye field for saccade, and the ipsilateral parietal lobe for the pursuit. These both have to talk to the pons to look right and to look left. The vestibular input from your ear can talk directly to the pons, and therefore if you do the doll's head maneuver and it can make the eyes move, that means everything from the pons down is intact. So we can test whether something's above or below this nucleus with the doll's head maneuver. And if it's able to move the eyes with the doll's head, or if the patient can reflexively look, or if there's a dissociation between the pursuit and the saccade. They cannot saccade, but they can pursue, or vice versa. This is what we mean by supranuclear. It is above the nucleus in the pons of 6. And so in the frontal eye field, it is the contralateral frontal eye field. So the right frontal eye field makes you look to the left, and the left makes you look to the right. And so if you have a frontal eye field lesion from, let's say, infarct, MCA distribution infarct, you can have either a destructive lesion in the frontal eye field, and if you damage the right frontal eye field, then you won't be able to tell the left sixth nerve nucleus to look to the left. And so if you have a destructive lesion in the right frontal eye field, the left frontal eye field will be unopposed, and so it will drive the eyes to the right. So you'll be looking towards the lesion in a destructive lesion. If you have an irritative lesion in the right frontal eye field, that will stimulate, because it's a seizure, the left sixth nerve nucleus, and so the eyes will be directed to the left. So a stimulatory seizure irritative focus in the right frontal eye field will push the eyes with a gaze preference to the left, and a destructive lesion on the right will be unable to look to the left, and so you'll be looking at the lesion. So you need to know a little bit about the supranuclear horizontal gaze palsy, the difference between a destructive and an irritative lesion in the frontal eye field, that the frontal eye field control is contralateral, and that the pursuit is in the ipsilateral parietal lobe. Any dissociation between the saccade and the pursuit, or the doll's head maneuver, proves that it is supranuclear in the cortex, and the most common cause is stroke in the acute setting, but it can be hemorrhage or tumor or any lesion in these locations.